If you have diabetes mellitus, or diabetes as we generally call it, you have too much glucose in your blood. This causes you to have to urinate a lot and feel thirsty all the time. It can also make you tired, sleepy, not feel well, and lose weight. Glucose is a kind of sugar. It comes from the food you eat and ends up in your blood. Fruit, bread, beans, rice, pasta and potatoes are some of the foods that contain glucose. The food is broken down into small pieces in your stomach and intestines. The glucose released during this process is absorbed into your blood in the small intestine. The glucose in your blood is called blood sugar. Your blood transports the glucose to all parts of your body. The cells in your body need it for energy, so that you can think, move and grow. Some of the glucose is stored in your liver as a reserve for later. These glucose reserves are used when you, for example, do exercise. Your body is made up of a huge number of cells. These cells come in many different types, such as muscle cells, brain cells, blood cells, skin cells, liver cells, and many more. They are like tiny factories that need glucose to operate properly. And they get that glucose from your blood. To be able to get the glucose out of your blood, your cells need insulin. Insulin is a hormone, a substance, that is produced by your pancreas, which is an organ in your abdomen. Insulin makes it possible for the glucose from your blood to enter the cells. It works like a key that opens the door to a cell, so that the glucose can go in. When you have diabetes, you are not making insulin. In some cases, you are not making enough insulin and it is not as effective. There are various types of diabetes. Children generally have type 1 diabetes. This is when your pancreas does not produce insulin. Without insulin, the doors to your cells cannot be opened, and the glucose stays in your blood. You then have too much glucose in your blood. Seeing as your kidneys cannot process all that glucose, the glucose ends up in your urine, along with extra water. This is why you have to urinate so often and feel thirsty all the time. Since the glucose cannot get into your cells, it cannot be used as fuel to give you energy. Your body has to get the energy from other sources, and that is not good for you. This leads to all kinds of discomforts and symptoms, such as tiredness, fatigue, not feeling well, and weight loss. When it gets really bad, you may even lose consciousness. Type 1 diabetes is caused by your body attacking and breaking down the cells in your pancreas that make insulin. Your own immune system does that, which normally defends you against harmful bacteria and viruses. This is why it is called an autoimmune disease. We don't know yet, however, what exactly makes your body do this. Sometimes children have type 2 diabetes. Your pancreas does then still make insulin, but less of it, and the insulin is less effective. As a result, the cells get less glucose, and there is too much glucose in your blood. Elderly and overweight people who do little or no exercise tend to have this type of diabetes. Since there are more overweight children now, it has become more common in children as well. Diabetes doesn't go away. To be able to live with diabetes without the discomforts, you need to prick yourself every day to measure your blood sugar level and inject insulin. Plus, you cannot just eat anything you like, and you need to be careful what you do, such as sports and exercise. This can be quite hard. It is very important that your blood sugar level does not rise too high, hyper, or drop too low, hypo, because both these situations could cause serious problems. Luckily, your parents or carers can help you manage your diabetes. And you will also have regular appointments with a diabetic nurse and a doctor to see how you are doing.